Hello and welcome to McLaren Port Huron's Today's Health. I'm your host, Barb Winters. Our program today is about kidney stones. And in joining us for this important update is board-certified urologist, Dr. Glenn Betrus. Dr. Betrus, welcome back to Today's Health.
Thanks for having me.
Let's start at a real fundamental place for me, and that is an update on anatomy of the urinary tract.
So the urinary tract consists of two kidneys, the right kidney and the left kidney. Each kidney produces urine. The urine drains down a tube called the ureter into the bladder. So you have two kidneys, two ureters, and one bladder. The purpose of the kidneys are filtering organs. So they filter the bloodstream, remove toxins from the bloodstream, regulate fluid balance. So if you drink 4 cups of coffee and then you find yourself needing to urinate, that's because the kidneys have recognized that there's too much fluid in your system. So the kidneys have filtered that excess fluid out and produced increased amounts of urine. And also the other function of the kidneys is to regulate blood pressure.
So what then are kidney stones?
Well, kidney stones, I always use the analogy of a science class that we had in high school, where you take a glass of water, you put a teaspoon of salt in it, you mix it up and it dissolves. But if you continue to add salt, eventually the solution becomes what we call saturated enough that crystals form. And kidney stones are crystals that form within the urinary tract, and then they come together and form actual stones as depicted on the diagram here. So these are stones within the kidney. Those stones can form in the kidney, they can sit in the kidney for years, never cause a problem, never cause pain. Passing a kidney stone is when the stones pass out of the kidney into the ureter. And the problem there is that the stone blocks the ureter, so the urine being produced can't drain down to the bladder. The kidney doesn't know that, so the kidney continues to produce urine. The urine backs up into the kidney, so there's increased pressure in the kidney, and that causes pain.
Are some people at greater risk to get kidney stones than other people?
There are definitely increased risk groups by race. Whites are more likely to get kidney stones than people of other races. By gender, males more than females. People with inflammatory bowel disease, obese patients, those are patients at an increased risk as well.
Are all kidney stones the same? I mean, you told us a little bit about how they're formed, but are they all made of the same thing?
No, the majority are made of calcium, but some stones are made of uric acid, some stones are made of struvite, which is associated with infection, and a small percentage of stones are made of a chemical called cysteine. But the majority are made of calcium, but, and I know we're going to talk about this a little bit more, but while I'm mentioning calcium, it is important to mention that people don't necessarily form calcium stones because they're consuming too much calcium.
Well, I was going to ask you that. Do the different kind of stones kind of alert you to if someone has had an infection, then you're like, oh, they might have a kidney stone?
So you start looking at, some patients have a family history of kidney stones, so then you look at what type of stones that they have in their family. If they've had infection, you're looking for a struvite stone. So indeed, there are different types of stones that you're looking for based on these characteristics.
Compared to all the different things that happen to the urinary tract, how common are kidney stones? Is that a common event?
It's common in our practice, certainly, but about 10% of adults get kidney stones. Primarily, patients get kidney stones in their middle-age years. And of all people who get a kidney stone, 50% of patients will get another stone within 5 years.
Well, we always like to ask right away at the beginning of the programs, can you prevent things? So can you prevent kidney stones?
You can indeed. The best ways to prevent getting kidney stones is to increase your fluid intake, and that's true regardless what type of kidney stone, whether it's calcium or uric acid or cysteine. Increasing fluid intake decreases the risk of getting kidney stones. Lemonade and orange juice are especially good things to drink because they're high in citrate, and citrate dissolves crystals in the urine.
Great information. We're going to take a break. We'll be right back.
Thank you.